Giant every year is really kind of building innovation for the future, trying to bring a community together. And actually what we're going to be showing next half an hour or so is 3 startups from around Europe. The BBC actually called Giant a leading magnet for innovation. And Financial Times described us as the biggest health tech event, medtech event across Europe. So we're pleased that we're kind of pushing and driving change with bringing innovative startups together. So what we're going to be doing now is, I'm sure we've got the 3 startups here. Hopefully they're here. SunScreenIT, are you here? Yes. Viseven, yes. And VZN Consulting. You're all here. So the first one is SunScreenIT. You are first on my list, if that's okay. Yes, click us on here. What's your name?
It's never been more important to recycle and reuse. IT creates more carbon than the airline industry, with millions of litres of water used daily and Earth's precious materials being mined.
Developed nations have been flooding West Africa with electronic waste.
We can take all of the profits from IT asset disposal and plough them into amazing projects like here in Sierra Leone, West Africa.
Here was I using in my day-to-day life a thin client device, and I just had the connecting thought.
We're going to transform the IT industry to avoid carbon, water and raw mining on a grand scale.
I'm here to call out that it's not acceptable anymore to send electronic waste to Africa or any other developing nation.
We're desperately looking for more clients to grow our business so that we can help change thousands more lives.
IT is the gateway to knowledge and opportunities, I feel.
If we have ICT skill, we'll be able to change.
We are so glad and we are happy for what we have done for the school.
There we go. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, that's the only thing that really ever has. I love that quote. I don't know if anyone has seen that one before. That quote, Margaret Mead, look her up. I start a lot of my business presentations, my client presentations with that. If you think about what that means it's that one small voice in an organization that says, hold on, there might be a better way to do something. And that's hopefully what I'm going to say to you today, and hopefully give you some ideas that maybe you can echo in your organizations. Doesn't matter if you're a decision maker or an executive, that small voice of reason, that small voice of change can set off a massive ripple effect. And I think the future of hospitals and the future of healthcare is something we plan. That's our mission, to make a massive impact on, both with social outcomes and environmental outcomes. So that's what I'm here to talk about today. I'm going to tell you the story about where this came from. Before I do, my name's Nathaniel. I'm the founder of the SunScreenIT group. SunScreenIT consists of a limited business and a registered charity, 2 separate entities that exist because of and for each other. Okay, and I'll explain how that works. But it all started around a Sunday lunch table in Somerset. All of my family are teachers. I didn't go into teaching because I saw my family enjoying it that much, but that's another story. But I met some teachers from West Africa. They were visiting as part of a Foreign and Commonwealth program. They were visiting a school that my mother taught at in Somerset. And I asked them, what computers do you have in the school? Thinking they would say none. They said, we've got hundreds of PCs in West Africa in this tiny school in Ghana. I said, well, that's great, fantastic. Where'd you get them from? Oh, charities give them to us. Great, well, fantastic. Wow. Yeah, we stack them up, and we make desks out of them, and then we maybe room dividers, and then we burn them. Oh. So how do you teach IT? Oh, we have a picture of a mouse on the wall and a picture of a keyboard. So how do the children graduate with IT skills? Oh, no, they don't. And how are they getting jobs? Yeah, they're really struggling. So you've got this massive toxic waste. And a long story short, I couldn't believe my ears. This was 15 years ago. And I was working for dastardly large organizations like Oracle and Sun Microsystems and BMC Software, if anyone's heard of those technology companies, for decades. And I heard this. I couldn't believe my ears. So I said, there's got to be something we can do. Traditionally, the IT charity model has broken the system. We flooded soft target nations, not just West Africa, but we flooded soft target nations, low-income nations, with donations of IT because it's cheaper to stick it in a container, send it overseas, pat ourselves on the back. but it's created statistically the most toxic places on earth. There are places the size of Bristol, just outside capital cities in Ghana, Accra. This place is called Agbogbloshie. We've been there and it's hideous. It's post-apocalyptic, and today there are 18 million children living on these digital dumps, existing off them, burning this stuff. They're supposed to be learning IT, they're burning IT, and they're developing lung cancer rates at the age of 11 and 12. It's a hideous hellscape out there because all of our stuff. Who had a massive TV in the early 90s that you needed someone else to help shift and pick up? Anyone in the house? Yeah, a few. Those are still in existence. They're probably being used as stepping stones to get across a river in a place like this. Okay, so we've created a big problem, but it's not all doom and gloom. There is a bit more doom and gloom to come. If we continue consuming on the basis that we are now, the planet Earth will be out of gold, platinum, silver, and copper metals in about 30 years, which is why Elon Musk loves the idea of catching an asteroid and bringing it up. So please God, that doesn't happen because that would ruin the Earth. But anyway, the good news is there's already $65 billion worth of metals already taken out of the ground, lying dormant and unaccounted for in electronic waste. And there's this thing called the urban mine. Anyone heard of the urban mine? Urban mine is a phrase, please remember it. It's the description of all the metal which is sitting in your cupboards at home. There might be some devices in your houses. This isn't a guilt trip, but there might be laptops, phones, PDAs. There might be devices that you just don't know what to, I'll get round to that. There's $65 billion worth of metal sitting in the urban mine, which has already been refined. So we've already got enough metal to make the circular economy in IT work forever. But we're not making it work because we're not recycling it, we're not refurbishing, and we're not reducing in the right way. So that is our mission. SunScreenIT exists to change, and we've got a load of NHS clients who are already coming on board. We've been properly going. I founded the charity as a side project, but I went full-time from my career a year and a half ago, and we're really rocketing. We've got NHS Trust signing up left, right, and centre. And I believe the future of hospitals really does, at least in the IT and some of the devices as well, the dialysis machines, and we haven't picked up an MRI scanner yet, but you never know, dream big. But what we do is we have a fleet of IT asset disposal businesses who have signed up to us. Centerprise International CI Recycling is the main one, the lead one. They have very secure service. They service MOD clients. It's very, very secure on the data. This is really essential. When you're picking up electronic equipment, it has data on which is highly sensitive. So we can deal with that on an enterprise level to an MOD standard. The difference then from Acme scrap merchants and our model is that we extract the value by refurbishing as much as possible. Now, if we cannot recycle our way out of climate change. Absolutely impossible. Recycling actually has a big carbon and wastewater footprint. Now, if we can extend the use of viable IT assets, which we do that, we remarket those get sold. The money, some of the money comes back to the hospital trust. And guess what? The brilliant people at the hospital trust say, hey, give that to our charity. So this is an example of one of our clients. This is the Royal Berkshire NHS Trust. And they came with us only a year ago. And I'm going to show you what they've achieved with us. The Royal Berkshire NHS decided to come with us in November last year. So they've said, don't give us the money back, give it to our charity, which is fantastic. So instead of what they were doing before was shredding IT, they were paying £1,000 a month for a truck to turn up and shred the stuff. And of course, massive carbon footprint, massive loss, because when you manufacture a laptop, it causes the use of 190,000 litres of water. Right, so one device needs 190,000 litres of water to be made. And everything in this room will probably end up as waste in the next 5 or 10 years. Even the chairs are good, right, so they'll last, but all this stuff, everything you see, if we think about the consumption, it's wrecking the world. But the good news is we've got options, and I believe this is truly a way to transform the way that the NHS and also the other private healthcare, not just NHS. We're very happy to work for Bupa and Nuffield if you're here in the room, and whoever else, BMI and the others. So our model gives back funding to the NHS charities, but then also we carve off the margin. So previously, this would be taken to the bottom line of a private company, and thanks very much, or a private organisation, it's profit. We give that profit to my charity, SunScreenIT, which is a registered charity in the UK, and the charity go on to go and close the digital divide for pupils in areas of low economic, of areas of economic need around the world. So we've been to Sierra Leone, we've been to Ghana, we've been to a youth project in Leeds. We're going to be delivering to a youth project in the Wirral, in partnership with the NHS there, which is a really exciting project. And also not just computers, but interactive novel spatial stuff for disadvantaged children with disabilities. We're working on planning a school in London called Greenmead School with some really fun stuff, not just keyboards and mice, but interactive walls. So the beauty about this, the way we've changed the IT model, I said it was broken. And the comparison I'd make is, imagine a clothes charity. And there's a deceased grandmother, God rest her soul, in Birmingham, who no longer needs her clothes. And there's a 6-year-old boy in London who has no clothes. He has clothes poverty. The old IT model was as ignorant in places as just saying, well, she doesn't need clothes anymore. Let's send that to that 6-year-old boy. And we know a 6-year-old boy is not going to enjoy walking around the playground wearing a 5-foot-long flowery dress. That is as stupid as what we were doing with the IT charity model before. And of course, he throws the dress away, it goes in the street, and it turns into waste, and IT waste is the analogy there. So what we've done is we've monetized this. We've said, stop sending the rubbish to Africa. Stop sending the stuff that we just don't need anymore. Make it intelligent. Stop the e-waste. We capture that at source. We've got lots of commercial clients as well as the NHS. Make sure that never goes to a bad place and never goes to landfill. Monetize it and deliver what's needed. And we are so proud of our team at Royal Berkshire. This is the first collection they did. They were so happy, they took a picture. We didn't ask them to, they did. They were chuffed. Right, so these are the guys at Royal Berkshire, and Joe Warrior and Kate Martin in the charity team, and Sean and Glyn and Sean, two Seans, in the IT team there. And they made a change in November. So November last year, remember that, because these are the stats that we've achieved. First of all, we've done 5 collections from the site in Reading. We've collected just under 730 kilograms of stuff, and that's about 300 items. For our charity, we skim off the margin. The customers don't see that, and we don't charge extra. We're very aggressive on our pricing. We're the same or better pricing than all our competitors who do just straight as a business. So we've carved off £2,500, which enables us, because we know our charity can deliver IT, sustainable IT, to a child for £6 per pupil per year. Right? So we know we can change that many lives with that money. But then the beautiful environmental impact, because we refurbish this stuff. You don't have to make the item from scratch again. We sell it into the circular economy, and that saves 43 million litres of water, 95 tonnes of carbon, and it equates to 303 tonnes of raw mining not being needed to be dug out of the ground. Okay? Think about that. That's the circular economy at its finest. And it's only because, really, they decided to change who took out the trash. And we do the rest of it. We've been working on perfecting this model for 15 years, and it's really, I mean, our client list is just going up and up and up. And we're here today to really, I guess, make an unashamed beg to you all, because it's the single voice that makes the difference. If you feel able to send a single email to your managers and say, where does all our stuff go? If they've got a good answer, great, carry on. If they don't, sunscreenit.com, that's us. Please get in touch, because we truly believe we can make a difference. The greatest thing is the funding. We've given over £1,500 to the Royal Berkshire charity in the last 12 months, again as a byproduct. So we're talking social impact, we're talking environmental impact, and we're talking governance, because there's a lot of forensic detail on where the data's gone. It's all clear. The NHS is not going to be fined for GDPR breaks and breaches, and everybody wins from an ESG perspective. These are some of the results we've had from these wonderful children and young people, and it really comes home when you bring it into individual lives changed. Frances never had IT skills before Sierra Leone. She used our lab for 2 years. She's now running her own youth project, helping young mothers. Women in developing nations have the roughest ride of all, because they're told, okay, I'll pay for your education until you're about 12, 13, then, sorry, you're not going to give a good enough return in the family. Go home, find a husband, get pregnant. And it is that stark. But if they have skills to build themselves a career, that's the difference. This young lady, Marion, also in Sierra Leone, used our lab for 2 years. She's now working in a bank. She's not tied to a stove or being a baby machine. That sounds horrible, but it's true. It's absolutely appalling. But with skills, this chap has one arm. He's taught himself how to use IT, and he's now going into social work. Now he's graduating. These are only 3 examples of the thousands of students we've given IT to, and this, for me, is our highest purpose. When I go to an exec in a hospital, this is what I'm thinking of, because it's a long chain, and that's our outcome. Just to say, Royal Berkshire, what does 43 million litres of water look like? It's 16.5, 25 metres of swimming pools. That's great. I don't know if you like that or not. You might remember that. But this one I love. Why is carbon important? I'll tell you why. There's so little air on this blue planet we live with. There's this tiny layer of air all around the sphere. If you were to put all of the air in the Earth in one place, ball it all up, it would just about cover Europe. Okay, look it up. There's not that much air. That's why a ton of carbon, which looks like that, matters. 140 million tons of carbon are produced from making desktops in 1 year alone. And these guys in Royal Berkshire saved 95 of those bubbles that are now no longer floating around the air in Berkshire or wherever their manufacturer would have been. So huge credit to Royal Berkshire team. And we've got loads of other trusts who are achieving this and much more. We have Imperial, I hope they don't mind me saying, a much bigger trust. Chelsea and Westminster we work with, Northwest Anglia NHS. And we've got lots of private clients around the world who are coming on board with us. And they're enjoying the benefit of advertising their achievements. And rightly so. There's not greenwashing, it's fact. So the last thing I'll say, once we've mastered the disposal and circular economics around the IT that business is using, we can then ripple effect out to all the IT that's stuck at home in all those employees' homes in the urban mine. So we run a program, we say, right, January's coming, April's coming, we're going to run a week where you can bring all your stuff into the hospital and it's going to be collected as part of the very secure IT asset disposal process. And then the ripple effect, they've already saved 95 tons of carbon. That goes to 600 tons of carbon, just from the 6,000 staff, each one of them bringing maybe their old laptop in from home that they don't know what to do with. The ripple effect on that to our community and our world is huge. And we know we can produce huge social outcomes, and it's going to fund huge social outcomes. This is it, right? We all have an opportunity to make a difference. All our actions have consequences. And I believe, for me, education's a massively important thing. This is education. If you are so willing to take this message forward, that's education. And it's the only way we're going to change the world and the future of the NHS, the future of healthcare, is this could be a massive part of it. Right now, we are absolutely honoured to be working with the cabinet government ministers in Sierra Leone and UNICEF, who have seen our model and have said, this is perfect. Because if you gave a device to every child in a low-income country, you destroy the earth overnight, okay? You destroy the national grid. The way we do it with our sustainable, low-impact computers in specific schools, that's the model they're adopting. And our new target is to deliver IT to 1.2 million children in Sierra Leone with UNICEF by 2025, which is a massive goal, but we're already on target for delivering that programmatically with UNICEF. But it all starts here. Your voice counts. Send an email to your IT manager if you will be so kind, or your exec. And that's all. I'll leave you with that quote. Looks a bit better and less jumbled. Never doubt. It's only a small group that ever makes a difference. It's not the mob. It's that voice that stands up and goes, I think we can make it a little bit better. So thank you very much indeed.
Thank you so much. Thank you so much. Oh, thank you, Nathaniel. That's great. A man on a mission, and I think he made the right choice by not going to teaching. What do you think, right? Changing the world in many more ways than one. Okay, we have our next startup. It's Viseven. Is that you? Come through. Let's make sure your slides are on. So support Nathaniel. Email your IT manager. Nathaniel, what should they say?
Where does all our stuff go?
Where does our stuff go?
And if there isn't a good answer, SunScreenIT.
Send SunScreenIT. It's a lovely name, by the way. I love SunScreenIT. Is that cool? Yeah. I must say, yeah. All right. The floor is yours. Thank you.
Thank you. Good evening. Thanks for staying with us on the second day. I know it's tough, and especially so cold. I would like to build upon the previous speaker regarding every voice matters. Our motto within Viseven is saving lives by improving communication. We truly believe in that, and that's how we drive change. We drive change by enabling digital transformation within the pharma, medtech, life science companies. How do we do that? By using omnichannel AI-empowered digital factory, the content authoring platform for the pharma and medtech, and as well the enablement of one-stop omnichannel communication hub. This is the quote from our clients, that we are combining marketing and technology expertise. You saw there is like a lot of AI startups today, great innovation, but it all is important to connect with the proper communication in place, right? It's not only about the technology that we drive, but as well as combining it with actual tools, mindset, and skill sets in the organization. As well, there were speakers who emphasized on partnership, right? That is not anymore about competing, it's about collaborating. And there are a list of our partners with whom we work to drive the communication effectively and to enable the communication flow as smooth as possible. Our company is already 14 years old, but we are still like very much in a startup culture and driving innovation efficiently with our clients in different fields, in educating the pharmacists, educating the patients, and kind of driving the communication across the pharmaceutical industry. We are as well global companies, so we have been based in Ukraine initially. Now I'm in Estonian headquarters in Tallinn, and as well we have the colleague from Belgium, Vlad, here. And yeah, we try to support our clients 24/7, basically being based in all parts of the world. These are top 50 life science companies which trust us, but as well, like the list is much bigger than that. So this is already the kind of outcome of this great collaboration and driving the change and digital transformation across. So here are the main challenges that we are trying to overcome and to support pharmaceutical industry with. For example, the MLR approve pressure. Within our platform, eVizard, we support with the enhancing the medical and legal review, that the system will automatically, with AI enhancement, will support you to go through the medical legal review in a quicker way by checking the references, checking the claims, making sure that actually the content that you are preparing would be valid and released to the physicians in a much more advanced way, so that you receive the information not in 2 months after some clinical studies has been released, but as early as possible. Then expectations for the localizations for sure. So although the global could be releasing some campaign, it's really important to localize it and to bring it according to the affiliates, right? So with AI empowerment, we have the opportunity to localize in one click and to drive this enhancement within across all the affiliates. So basically, all the challenges are incorporated to be covered within our platform, like to support the pharmaceutical industry to drive the change within the communication in a more efficient way. So how do we stand out? We bring everything under one roof. So this is not only the consultancy, but it's as well the digital solutions. There is like a CRM, CLM solutions that we offer or build upon already those preferred solutions that the clients have. There is as well the professional services like mobile engineering, like many patient support apps, as well VR, AR opportunities to kind of have educational programs there, and as well like change management on top of it, because it's not only important to have a proper tools, but as well to make this shift within the mindset, within the skill set of the organization to deliver the proper message. This is a little bit about eWizards, our platform, a little bit complicated slide, but actually the very user-friendly interface to enable the self-service within their organization. So there is no need already to contact the digital or creative agency. They can be creating the content themselves, like by brand team, by kind of content authors with no digital skills. It enables to create the assets like emails, ID tailings, landing pages, mobile application, or as well like creative content for the educational purposes in much more enhanced way. Yeah, so as I mentioned, mindset, toolset and skill set are very important to combine and to drive the change. So it's not about just bringing those cool AI technologies and like, yeah, surely with the AI technologies, digital communications are most empowered, and like that's where we can boost effectively without being afraid, right, of kind of restrictions, and like we have less regulatory legal kind of constraints which were mentioned before. How do we drive change within the organization? First, ideation. So surely bring across your team, ideate, think of new ways to approach and to find the things, screen partners. So it's very important to look outside of organization as well, not only inside, right, to kind of not to be in this bubble. Indoors, so mobilize all the stakeholders within the organization. So it's not only top down or down up, right? There should be like everyone aligned to the same mission. And track the progress. So track the progress, make a plan, set the KPIs, and go ahead with this business value realization which you're trying to achieve. And don't be afraid to fail and to start again if you fail it. Data is in the core, so it doesn't make sense to kind of make something if you don't have the KPIs in place and what you are trying to achieve. So it's important to have this data and analytics. Don't kind of overuse it as well and don't get stuck within it, but do build upon some data and KPIs that you are trying to achieve, and this is something as well that we support our customers with. As well, regarding this approach to innovation, it's important to pilot things, not to be afraid to kind of fail and restart again. So we try as well to encourage our clients to play with the new technologies, with the new tools, to run small proof of concept projects and to kind of standardize, innovate, pilot it, and then like reframe and restart again if there is a need. Yeah, so just to kind of summarize it again, so these are the key challenges as well by running this digital transformation. So there should be a mindset. So we do run the change management programs to adapt the new tools, the new skill sets. Then don't underestimate the people components. So surely the people have to be as well on top of what has been presented and like kind of know what we are driving to, have the capabilities to reinforce the change, have this outside-in perspective to involve all those amazing agencies, partners who know better than you, who have the particular competences within, and this is why like this as well events is one of the important one, right? To build those connections and to see who is bad at what and to combine those missing pieces. Silos exist, they do exist within the organization, and it's important to map as well different stakeholders and to make sure that there is a flow of information, of the KPIs, and the progress is being tracked. And don't wait for the perfect data. So yeah, so mindset, skill set, and tool set, again, re-emphasizing that. So many AI startups today, but do empower that with the proper skill set and as well mindset of people to adapt this technology, not to be afraid to try out, to fail, to restart, to kind of see how the things work. And then identify this target state. So don't just play around with the new technology, but what is actually the problem that you're trying to solve with it as well, right? Like put those ambitions which you're working on to achieve and experiment. Yeah, so evolve as a team. You cannot make a change on your own. Put customer in perspective. It's important to collaborate as well, like in the healthcare system with the HCPs, with the nurses, and that has been like a great opening for me, like how engaged they are today as well, and like how much feedback we receive, like, oh yeah, this is a great tool, we would like to have it within our hospital. That's amazing. Like, we should listen to those insights of what is actually needed in there. Outside in, yeah, look for those partnerships, like who can make more, like not a single like pharmaceutical company can like stand in the silos. They need to adjust and like play with the partners to achieve the best goal. KPIs and tracking, and bridge the gap from the global to local. It's important to know the local needs, but as well like to scale from this global marketing campaign to the local and break the silos. That's it. Thank you for attention.
Thank you so much. Thank you so much. And thank you for coming to Giant to share your stories. So another amazing startup. I think we have one left, which is VZN Consulting. Should we have the slides up? Thank you so much.
Thank you. So hey everyone, hopefully my slides will be a lot shorter. I'm going to try and keep it as fast as I can. So I'm Hussein. I'm founded VZN Consulting. It's a startup for health tech startups. And it's a weird way of saying it, but my idea behind it is turning your vision for health tech into a reality. I'll start up a little brief introduction about me, but that doesn't start without my best friend, which is my daughter. That's on the right hand side. But I started developing when I was eight years old, and I built my first website in HTML, and then I built it for my, during lunch times, they blocked games website, so I built my first games website at school. They blocked that, then I made another one, then they blocked it again, then I made another one. But then for some reason, because my parents told me to go into tech, I said, no, I'm going to go into medicine. I tried for that, didn't happen. Started doing biomedical sciences, realized that my parents were right all the way through. So I then dropped out and did computer science instead. Started my agency as a business, didn't quite work, but ended up working in the pharmaceutical industry, coming from a medcoms industry background, and really using my digital strengths and assets in computer science to develop solutions for healthcare professionals and patients, but targeting it from a pharmaceutical background. And I've been doing that for however many years it's been. In the past 3 years, I've started working directly with pharma, consulting for digital solutions. And in the past 3 months, I've started consulting for health tech startups. And the idea behind that really is, it comes from this quote, and I think it's by Les Brown. I'm not too sure. There's a few owners for this quotation that I've seen online. But the idea is that the graveyard is the richest place on earth because it's here that you find all hopes and dreams that were never fulfilled, the inventions that were never shared, all because someone was too afraid to take that first step. And I collaborate with non-technical folks with my technical understanding to really try and bring that innovation into reality. I put the tech in your health tech. That was the cheesy line I came up with. But so I was going to talk about how to get started within digital health tech. And the whole conference has been very informative with the little bits that I've attended. And so I'm not going to bore you all with a lot of the bits that you've probably heard a million times now. But just to go through a few steps really is finding out your why, right? It's why are you trying to solve what you're trying to solve and who really benefits from it. Let's identify that. Once we've done that, let's define your MVP. Outline your key metrics, key functionalities. What does that look like? And here we do a competitive analysis. We identify any other systems and platforms that we need to integrate with, and I can support with that part. That's where I come in with my digital expertise to understand your digital landscape that you're already battling. Of course, you need other stakeholders to come in. We had the IP team earlier. You need regulatory compliance. You need health economists to come in. Don't know anything about that, but I do have a great network of consultants who can support with that. And together we find out if the idea is worth pursuing. If it is, this is where I really start to shine, or I hope I start to shine, and that's to develop your first MVP. I work with you with the digital landscape to understand the technologies that are available, understand the technologies that need to be developed, and take it to a level where we are either developing a prototype or we're developing an MVP, so you can then take it to the next step, which is to either go for funding or you scale up depending on the trajectory that you want to go in. So that's a really quick overview of what I do and what I'm trying to accomplish with Vision. I have a few consultants that I'm working with, project managers, technical folks, compliance folks, and health economists. So if you have an idea, if you're a clinician and healthcare professional and you want to develop something, you're scared of the tech that's ahead of you, get in touch and I would love to help you there. And that's the website. I should have added the QR code. That was the trend, right? But yeah, here we go. That's the website.
Thank you so much. Thank you. Yeah, so in fact, I'm glad you didn't do QR code. We're QR code done. We're in a frenzy, right? There's too many QR codes. Thank you so much. That's the end of the startup session. So thanks for coming along and sharing your experiences, your journey, and the failures. Startup journey, we've all been there. I've done so many that have failed abysmally. Some are succeeding now, but it's a journey that we all have.